Hi, I'm Eli Allen. I'm 20 years old, and I'm currently a student at Mitchell College. I'm first going to get my bachelor's in early childhood, get certification, but then I may eventually want to go to grad school, getting either a master or doctor in ABA, and go more to a school psych route by doing, evaluations and working with the kids and doing the assessment, doing the home programs. And my first memory of what it was like when I was, autistic, I remember the feelings of frustration when I couldn't express myself, and zoning out a lot, like not and they would say like I wouldn't respond to my name. I was really little to really remember the whole ABA program because I was like three and a half, four. But I do remember Bobby and I remember the home program. Before we did ABA, I mean I had ABA. We did other interventions, but the only thing that really got me to talk and to look at people and learn all the skills I was lacking was ABA. I remember there was times where I definitely struggled or I didn't want to work, and there was definitely really frustration. But I think there was other times where I really enjoyed it and it was rewarding. And I watched a lot of tapes of when I had the home program in my playroom, and I remember it looked like I was having a lot of fun. I think I do remember that. Um, Well, I do think ABA is the gold standard for, varying from behavior management to teaching skills they're lacking. I think you have to sometimes individualize it. Like, I feel a child who's more, isolated or withdrawn from their adults and caregivers and other adults to engage them to gain the relationship and imitate them and follow their lead. And then once you get that relationship, then I think you should use ABA because the core of it is to understand behavior, teaching replacement behaviors, and it's used for a lot of different things other than autism, although it is proven in that field to teach, replacement behaviors. And then once you're able to reduce them by replacing them, then to start like a discrete trial instruction and natural environment teaching procedures in combination. um there's definitely a lot, like even in this country there would be a lot of parents that would say, oh, we did some ABA, didn't work, and made them robotic. And I think a lot of that is because some people just implement discrete trials, and that alone, but a lot of behaviorists and people in the field are finding that that alone is not effective when you combine it with some that also incorporates following their lead and their interests to teach them new skills in combination with the structured discrete trials. And I think it's important for every child to receive some sort of ABA intervention. I think there is some that don't do well from discrete trials at all. I think nowadays you would even start with an errorless teaching procedure which uses Skinner's verbal behavior first to prompt them so it's not as overwhelming, and then you challenge them with a discrete trial, and then also generalizing. But if they don't in several weeks, and then I would think you can move more into a pivotal response, which is an ABA procedure. Obviously, as I said, I probably wouldn't be talking, responding to my name, or anything like that if it wasn't for Bobby and the home program. And I would definitely advise any parent to do an ABA program because not only for me, but even my experience working with other kids, I've seen what it can do to a child's development, whether they just improve and learn more skills. And I've even seen some cases where they become indistinguishable, and that happens, the research says, just below 50%, where they're functioning normally socially, communicatively, no longer have like the stereotypic body movements or the affect their conversational skills. Although the vast majority will always be on the spectrum. But I think it's important to know that if it's done very effective, it can really change a child's life, and I think it's vital for any parent to get the high quality ABA that they deserve. Going back to me being on the spectrum, as I grew older, I definitely remember the obsession, the restricted interests that would usually, you know, it would limit to that's what I would talk about. Also, I think because having trouble probably reading social cues. I always went to a school, and when I was even younger, I went to a camp that had a lot of support, but I feel like that did affect me, and I did get bullied for it. But as I said, from middle to high school, I went to a school that had a lot of support. So although I was definitely bullied a couple times, it was handled right away, and for the most part, um, but I've seen how it definitely impacted my life and how I think without the ABA when I was younger, and Bobby Newman, I probably would be in a home, probably not responding to my name or talking or all the skills I needed to learn when I was younger. And that's why I think, because I've seen how this impacted other kids, especially like because I had experience working with kids and I've seen what it's done. Like some vocabulary improved significantly. Another child I saw within a year of treatment, he was completely off the spectrum. Like his social, he like I never even knew he had social stuff because I didn't work with him the year before that. But they said he didn't talk a word, he didn't interact, and then they said he was like a completely normal kid. He was going to a mainstream school, and he wasn't on the spectrum anymore. So I've seen, and I know the research says this about what that happens to like right below 50% that they can make that full outcome where the social stuff and the repetitive behaviors go away. But I think every child that receives high quality, effective ABA treatment by someone that has a lot of experience, it's vital to get that treatment. And I also think that it's hard for a lot of parents to access it. It's a single intervention approved by the Surgeon General and American Academy of Pediatrics, and it's proven to be most effective. But they make excuses not to cover it. I heard about stories about parents who had to give up their home just to get services, and I think that kind of needs to change, especially since the research shows 90% can dramatically improve, and I've seen the improvements that kids can make. And I think, as I said, there needs to be more awareness of this, and there needs to be more funding for this kind of therapy because with the services you get when you're younger, the brain is more plastic so that it's easier to learn the skills that you need to learn for the rest of your life.